Welcome to another segment of our Partner Spotlight series, brought to you by the members of the Regional Chronic Disease Collaborative. The Regional Chronic Disease Collaborative members work together, combining their resources and expertise to help prevent the development and progression of chronic disease across our region. Our Partner Spotlight initiative is to help share innovative approaches being used throughout our region to improve population health.
Hello, and welcome to another Regional Chronic Disease Partner Spotlight. I am Erin Athelsted, a contract owner with Mountain Pacific, and today we will be talking to Tracy Gregg, with the camp manager, and Nicole Santonastaso, the Prevention Program Supervisor with Norton Sound Health Corporation, which operates Norton Sound Regional Hospital in Nome, providing services in Nome and the surrounding villages of the Bering Strait region. So thank you both so much for sharing with us today. And now I'm going to let you introduce yourself a little further.
Okay, sounds good. My name's Tracy Gregg. I'm a registered dietitian and lactation consultant. Been with Norton Sound for about 5 years. So we do serve Nome, and then we have 15 communities that we also serve. And so a lot of the work that we do, whatever we do in Nome, we also try to replicate that in the outlying communities. So that's like a very big focus of what we try to do.
Hi, I'm Nicole Santonastaso. As mentioned, I'm the Prevention Program Supervisor for the Camp Department. I'm a registered dietitian, an IBCLC, and a diabetes educator. I'm also a full spectrum doula, and I focus on anything related to wellness in the region. I really focus on that programming piece for preventative care. And like Tracy mentioned, we serve the greater Nome area, as well as all of the Norton Sound villages, and our population is primarily Alaskan Native. And we cover the range of ages as well. So we do youth programming through elder programming.
Great. And do you want to talk about some of the innovative approaches? I know you specifically have a program called CAMP, and I know it's not referred to like going camping. So if you kind of want to talk about that acronym a little bit and kind of what you guys are doing, that'd be great.
Yeah, so CAMP stands for Chronic Active Management Prevention Program. And it really started as a program to address both the prevention and the management of diabetes, as well as other metabolic disease. But it has really expanded into something a lot larger than that. So we don't just serve individuals with diabetes or those at risk with diabetes. We cover many chronic diseases. And we also have expanded to include injury prevention, as well as tobacco cessation and prevention as well.
Great. Do you want to talk a little bit maybe about the, is it the Veggie Bucks?
Sure. So through the SDPI program, we do incentivize participation in all of our programs. And we really saw a need to increase access to fresh fruits and vegetables. But as anyone who works in a rural area knows, it can be really difficult to rely on different community stores to provide that or provide an incentive program. So we decided to create our own, and with that, create our own veggie market. So through participation in our programs, whether that's an appointment with a dietitian or going to one of our workout classes or a community walk run event, participating in our newsletters, or again, just a variety of different activities, they can earn Veggie Bucks, and these can be used towards any of our produce programs that we also created.
Yeah, that's great. And speaking of the produce programs, could you also speak to the prescriptions for health produce prescription program?
Yeah, Tracy, do you want to take that?
Sure. Yeah. So the produce prescription program is income based. So participants do have to be eligible for either Medicaid or SNAP benefits or enrolled in those programs. And you also they also have to have a qualifying medical condition such as obesity, prediabetes, diabetes, gestational diabetes, hypertension. I believe that is all. So, in order to participate in that program, participants can either self-refer or they, like a dietitian or the medical provider that they see either at their village clinic or here in Nome can also refer them to that program. And then once we determine that they are eligible and they qualify, they receive produce every month, and it's based off of their household size. And then part of that program too is doing some nutrition education, so making sure that participants know what to do with the produce once they receive it. So we also include information on like storing fruits and vegetables, as well as including some recipes that they can also incorporate with their traditional foods as well.
Yeah, that's amazing that it's really tied to the traditional food. Could you speak to how these programs are funded and sustained?
Yeah, we so the produce prescription program is funded through a grant with GusNIP, and then we also receive a lot of funds through SDPI. That is also funded through a federal grant, and then we also have some funds through REACH. So all of our programs are grant funded. So we're definitely, rely heavily on those to support the initiatives that we try to do.
Yeah, absolutely. And you mentioned that there was a tie that the actual providers can refer to these programs. So could you speak to that kind of like clinical relationship with these programs? And even for the Veggie Bucks one, is there a tie there at all? Just speaking to kind of like that program clinical linkage.
Sure. Yeah. So with the produce prescription program, they do have to have some anthropometric, some biomedical information in order to participate in that program. So we have to have a height, a weight, a blood pressure, and then an A1C. So then we do rely on either the clinics or the providers to be able to gather that information for us. And then, so we do that at their initial enrollment. And then we check it again at 6 months and then 12 months. So there is, some data that we collect so that we can obviously see the impact that these programs are having on their health.
Yeah. So could you speak to any of like the results or changes you guys experienced by implementing these programs, maybe from a programmatic standpoint or a clinical standpoint?
I think that the program is still, in terms of produce prescription, still pretty new. We don't have those data marks. But what I can tell you is that I believe one of the reasons why we were such a qualified applicant for those grant funds was because of all the produce programs we were already doing in our region. And that really came from a place of addressing food insecurity and low food literacy. And that was due to lots of referrals from our providers for oral nutrition supplements to try to ensure that people were getting adequate nutrition and calories. And as dietitians, we knew, well, oral nutrition supplements such as Boost or Ensure does not solve the problems here. So how can we get more food into the hands of the individuals in our region? And so that is where our first produce programs kind of came to be, which is where we ordered produce from our hospital food supplier, and then we redistributed it to the community at cost. And that's where those Veggie Bucks came in, so that if cost was still a prohibitive factor, they had ways to earn money towards our produce program. And I think some of the most valuable feedback or data is really that qualitative data. I see it through emails and feedback surveys that we do with our participants that they refer back to recipes. When their store does happen to get a shipment of celery and sweet potatoes, I've gotten emails like, oh, I remembered that camp recipe and I was able to pull that and make it with this. Or, oh, my children sent me a box of produce and I had all these recipes that I could use. And so we really encourage participants to send photos of what they're making and talk to us about it and we incentivize that with those veggie bucks again. And so that, they're engaged in what we're offering. As a clinical result, we really have seen a decrease in oral nutrition supplement referrals, right? Like the providers instead have actual whole food options to offer them. And so then it was the opportunity to apply for produce prescriptions. And I think we felt confident in our delivery models as it was and what we were doing. And we were seeing the impact qualitatively, but maybe not quantitatively. So GusNIP really pushes us to do more of that research-based programming so that we can get that quantitative data and hopefully see improvements in the health markers. But it also was a way to just add sustainability to a lot of what we were doing because we are a small but mighty staff. So, every month when we do a produce bag sale, we can only really do about 40 bags because it's us packing them by hand. And so by opening that opportunity, we can serve up to 100 people, and that's sustained and packaged by a third party. And then people who aren't eligible and maybe have more of a steady income stream can purchase from our program, and that opens opportunity for them.
Yeah, that's amazing. And you're sending these bags to like all of your rural sites. That's correct.
Yeah. Mm-hmm.
Yeah, which is amazing. I mean, especially in like rural Alaska, getting fresh produce to these places. So I think that's such a huge win. Do you have, I know you kind of just spoke to a little bit, but do you have a particular story that you'd like to share about a patient's experience, or maybe how it was affected or impacted by this program specifically?
Yeah, I mean, not like a very specific story. We do have many who will email us and tell us that they go back and look at our recipes, which I think is because that is one thing that was really important to me when I created these programs, is that participants had buy-in, and number two, that participants were improving their food literacy and not just sending food out and expecting them to receive and just consume. I, number one, don't think that that's culturally competent care, which is also why I don't just send, blanket recipes that I find off the internet. Our staff works tirelessly to make sure that we edit each of them so that they're relevant to our region. And so I think that is super important. And I do see people utilizing those materials. Yeah, I guess not like one particular story, but I mean, I'm not even joking when I'm seeing people Facebook post being like, does anyone have the camp stuffed peppers recipe? And I'm like sending it to them on my phone. Yeah, so I guess, we really do see the difference, and we get so many emails of gratitude and people approaching us just saying thank you for what you're doing. It really does make a difference, which again, I think is a testament to how we're also approaching it, and that we're making sure we're being sensitive to, their culture and the foods that they're already hunting and gathering, and kind of just supplementing that. I think if it was just us blanket sending off these things, that it wouldn't have the same impact.
Yeah, absolutely. So could you speak to any other, which you guys have talked about so many, aspects of the project that you're most proud of?
Making those connections with people through food, I think, is really a beautiful thing. And she does an amazing job of making sure that, everything that we do is very aware of the culture and how that impacts it. So making sure that things are meaningful and not, like she said, just sending out things that we find off the internet. And I think, people really appreciate that. And I think a lot of us, have been here for a long time. And so we understand, the challenges that people face, and are aware of, just making sure that all the programs that we implement are meaningful to people.
Yeah. And I feel like you guys have done such a great job of implementing this in a meaningful way and incorporating it being tailored culturally. Do you have any other advice for those who might want to attempt some sort of food program? Anything that you guys might share with others who might want to implement something similar?
Yeah, I mean, I would say reach out because, we have had our failures too and the things that have and haven't worked. But I think the biggest thing is trying to find something that really fits the personality of your community, really the culture of your community, and ensuring that it's going to work. And that might take a little extra work, right? We're able now to use a third party to, package our produce and send it out. But I don't think that would have been as successful if we didn't first, do it ourselves, right? Pack it by hand and really do the process from start to finish. Because it gave us a lot of insight. It allowed us to collect a lot of feedback from people. And so that was really valuable in tailoring it to our communities. Because again, it was really important to us that we not only increased food literacy, but we also weren't creating more waste for the community. Also, again, being transparent about what's happening. There are times when I will send an email explaining, I packed this bag by hand. We are trying our best, and then they always come back with great understanding and thankfulness. I appreciate your feedback, but right now we're not in a place where we can customize every bag, for example, right? We have to kind of curate our selections because that's just what can be handled by us at this moment. And so the community is usually really understanding, and it just develops a really good partnership.
I'll also add on that too, just maybe getting some buy-in from your administration as well. And because I think for us too, they've been a great supporter of our programs. So I think if you can show them the impact that you have as well, then I think it makes it easier for them to support what you're trying to do.
Yeah, absolutely. Well, I really appreciate you both sharing with us today, and I can't wait to see how this program just continues to grow and continues to show the impact and improvement in the area that you serve. So I just want to thank you both for your time today, and hopefully we chat again soon.
Great. Thanks so much.
Thank you.
Great.
If you are interested in sharing your innovative approach, please contact one of these Mountain Pacific representatives. Thank you.